Good afternoon, everyone, and I welcome you to this session of Diarrhea Dilemma. It's a 30-minute interactive infection control session, and your participation in this interactive portion will make it a lot more fun today. I thank you for joining me, and I also want to thank you for your dedication to your healthcare profession. Before I introduce myself, I'd like to direct your attention to the chat box to find the link to our pre-session survey. Please take a minute to fill out the survey if you haven't already. In order to receive your certificate of training, you will need to complete this. I'd like to also introduce Abby Anderson, who is our project assistant. Abby is behind the scene today with the Project Firstline team in support of this webinar. My name is Lisa Ledoux. I'm an infection prevention training liaison with Project Firstline Rhode Island. I've been a nurse for over 30 years, and my experiences have been in acute care, pediatrics, emergency room, clinical education, home care, and management. And again, I'm happy to be with you all today. And I invite you to enter your name and organization and where you're from in the chat. And you can put your email down also, so you can be put on our distribution email for future sessions. This session is brought to you by Project Firstline Rhode Island under the Center for Acute Infectious Disease and Epidemiology at the Rhode Island Department of Health in partnership with the CDC. Once we start this scenario, the chat box is going to get turned off. So please put any questions that you have in the Q&A box. And then when we finish doing the challenge today, my colleague Stephanie Doyle will join me on camera and we will answer any questions if you may have them during our live Q&A session. And I thank you all for introducing yourselves and where you're from. Today's agenda, we just did our introductions, and we're going to review the objectives for this session. And then we're going to have fun with the interactive infection control challenge, go over some key takeaways, and do an end of session feedback, and then go into our Q&A. So our session objectives today, you're going to have a understanding of how infection control actions can prevent infection, know when to clean your hands and what method to use to decrease the risk of infection, applying proper donning and doffing techniques to help decrease contamination, and understand the importance and proper use of approved cleaners. You know that working in healthcare means that you're always dealing with the unexpected. So how well can you stop infection from spreading when problems come up? I have a scenario that I'm going to present to you today, and your job is to determine the correct action to prevent the spread of infection. After I ask you all the questions, there's going to be a list of answers for you to select. You will select the answer that you feel is best. Nobody can see your answers. This is strictly anonymous. And then we'll review the answers and see what the majority voted on and go over the correct answer. I'll do a brief rationale on the correct answer, and then we'll move to the next question. So as I mentioned earlier, your participation will make this a lot more fun. So let's get going. Here's a scenario. You walk into your patient's room and you go to change the bed linens. When you pull back the sheets, you notice that there's diarrhea on the sheets, and some of it may have possibly got on your hands. So as we advance to the steps of the scenario, I want you to pick the best infection prevention action that you would take. So are you going to put clean linens on the bed, put on a gown, put on a mask, put on gloves, clean the mattress, use hand sanitizer, remove the dirty linens and place them in the dirty bin, or wash your hands with soap and water? So again, to recap the scenario, you walk into your patient's room, you go to change the bed linens, and as you pull down the sheets, you see that there's diarrhea and it might have gotten on your hands. So what are you going to do next? What is going to be your first action that you're going to take? So please choose your answer, and then we'll go over and see how everybody did. And we're going to go by the majority. All right, let's see how everybody's doing here. All right, so we've got 82% said wash your hands with soap and water, and then the next was to put on gloves. So let's see if washing your hands with soap and water is correct. Excellent job. Yes, it is correct. You're going to wash your hands with soap and water. You're going to clean your hands immediately if you suspect that there may be stool or any other body fluids on them. So when you pull back those sheets, you may have touched something contaminated with stool. And if you're not sure the cause of the diarrhea, it's always best to use soap and water when washing your hands. Since diarrhea can be caused from germs, sometimes the hand sanitizer will not kill that germ. And so you want to, again, use the soap and water. So great job on that. Excellent. Let's move on to our next step. So you perform hand hygiene. Now what is going to be your next step in this scenario? Are you going to put clean linens on the bed, put on a gown, put on a mask, put on gloves, clean the mattress, use hand sanitizer, remove the dirty linens and put them in the dirty bin, or wash your hands with soap and water. So go ahead and make your selection. Take your time if you need to. Again, saw diarrhea on the sheets, you washed your hands, and now what are you going to do next? Let's see how everybody's doing here on the second step. All right, so we've got 85% said put on gloves, and 15% said to put on a gown. So let's see, let's go with the majority vote. So it's incorrect. We're not going to do the gloves quite yet, okay? So let's go on and let's see what the next highest percentage was put on a gown. And this is going to be the next step, okay? You're going to be putting on the gown as your first part of your PPE. The diarrhea can be caused, as we said, from an infection, and we obviously want to prevent it from spreading. So contact precautions is recommended for diarrhea, again, of known infection or unknown. So you will want to don that gown first, okay? If the patient didn't have that infection, you still put the gown on just to prevent stool from getting on your clothes, okay? So that was that step, but good job with that. Let's go on now to our next step. You have your gown on. Now what are you going to do? Put linens on the bed, remove your gown, put on a mask, put on gloves, clean the mattress, use hand sanitizer, remove the dirty linens, or wash your hands with soap and water. So again, we washed our hands, you put on your gown. What's going to be the next step that you're going to take? And you got your list right there. So go ahead and choose your selection. See how everybody's doing. You guys are doing great. All right, so we got 69% said to put on gloves, and 31% said to put on a mask. Let's go with putting on the gloves, the highest, the majority vote there. And you're correct. Good job, guys. You are going to put on your gloves next. Okay, that diarrhea, again, can be caused from infection. And as we just said, you want to use contact precautions when you're dealing with diarrhea. So the gown is put on first to keep your germs off your clothes, and then you're going to put your gloves on. So you want to make sure that the gloves will go over the cuff of your gown, right? So you already have your gown on, you're putting your gloves on, you are making sure that that glove is over the cuff of your gown to making sure you're covering the skin on your wrists and your hands. Good job. All right, we're going to go on to the next step here. So you guys are all doing great. Now that your hands are washed, your gown's on, your gloves are on, what's going to be your next step? Are you going to put linens on the bed? Are you going to remove your gown? Are you going to put on a mask, remove gloves, clean the mattress, use hand sanitizer, remove the dirty linens, or are you going to wash your hands with soap and water? So you guys can make your selection there. So again, you have your gown on, you have your gloves on. So what's going to be your next step in this scenario? Let's see if everybody made their selection. So 58% said to remove dirty linens and place it in the bag. And 39% said to put on a mask. So let's go with the majority on removing the dirty linens. Excellent. Excellent job. So you're all right there. Good job. You have all your proper PPE on now. So you are protected. So now you can safely remove all the dirty, contaminated linens. You want to hold those linens away from you, right? As you go and put them inside the dirty linen container. And if possible, if you could bring the dirty linen container close to your bedside, that's one of the best situations. And you don't want to put dirty linens on the floor because now you've just contaminated another area. And if you can be proactive and try to have your clean linens nearby and, keep it all in that room, that'd be great. So good job with that one. And let's move on to our next step. So you have removed the dirty linens and you place them in the bag. Now what's going to be your next step? Are you going to put clean linens on the bed? Are you going to remove your gown, put on a mask, remove gloves, clean the mattress, use hand sanitizer, or wash your hands with soap and water? So you guys did great. You're doing a really good job with this. So we removed the dirty linens. We have our PPE on. What are you going to do next? Let's see how you're all doing. Let's see what everybody's choosing here. All right. Let's see. We got 52% saying clean the mattress and 34% remove gloves. Some are saying to remove the gown, but let's go with the majority, which is cleaning the mattress. Let's see if that's right. It is. Excellent. So now you're going to clean the mattress. So once those linens are removed and you're still wearing your PPE, you are going to clean that bed, you're going to clean the mattress. You want to keep the dirty gown and PPE on while cleaning a dirty mattress, okay? And use products that work against infections such as C. diff or norovirus, if the source is or if the source is unknown. You don't want to you want to make sure that you use a proper disinfectant that is going to be effective against that particular organism. Okay, so read the labels on your disinfectants. Know your contact or your dwell time, which is how long the disinfectant needs to stay on a surface before you wipe it away. And if you're ever unsure of what to use, check with your supervisor. You guys are doing fantastic. So we are good. We are moving along now. So now that you have cleaned the mattress and you have your PPE on, what are you gonna do? What's the next step after you just clean the mattress? Are you going to put clean linens on the mattress? Are you going to remove your gown, put on a mask, remove gloves, use hand sanitizer, wash hands with soap and water? What are you going to do next there? So you already got the mattress cleaned. What are you going to do next in this scenario? And I'm seeing some of the answers coming in. Let's see how everybody's doing here. So we've got 48% that says to remove gloves. 33% say to remove gown. And then some 15 said to put clean linens on the bed. So let's see, the majority vote was to remove gloves. Let's see if that's correct. No, you don't want to do the gloves. Let's go with removing the gown. That was the next one. Okay, so this is the step that you're going to take, okay? You are going to remove your gown. Now, you want to remove your dirty PPE first before you touch any clean linens, right? So failing to remove PPE could result in contaminating these clean linens. So something to note here in this step. For an example, if you're using a one-time disposable gown, you want to remove your gloves and your gown together, right? Take it off, roll it into a ball away from your body and discard it properly. If you're using a reusable gown that you are going to untie around your neck, then you will take your gloves off first. Because if your gloves are dirty, you don't want to be touching your hair or your neck, okay? Especially around the area with dirty gloves. So you always want to remove dirty first, okay? But good job with that. So we removed, like we said, we just removed our gown, right? So now what's going to be the next step? Are we going to put linens on the bed, put on fresh gown, put on a mask, remove gloves, clean the mattress, hand sanitizer, remove linens, or wash your hands with soap and water? So we just removed our gown, right? Now what's going to be our next step in this scenario? Let's see what everybody's choosing here. All right, so we got the majority is 63% saying to remove gloves. And then below that is washing, the next highest answer is washing hands with soap and water. So let's see about removing gloves, if that's the correct step right here. Yes, okay, so we just kind of reviewed that in the other step prior, correct? So you are going to remove your gloves at this point. You're going to continue to take off your dirty PPE to prevent spreading stool and germs to those fresh linens. So before you work with those clean linens, you want all dirty PPE gone, all right? You don't want to keep spreading it. So you always remove your gloves if there's a chance that there was contamination. And if you see that you've got your gloves look dirty, even throughout any part of the scenario, if you see contamination, you will take them off, wash your hands, and don a clean pair if you can visibly see soiled gloves. Okay, let's keep going. We are almost there, you guys. You're doing awesome. So you removed your gown and your gloves. Now let's see what you're going to do next. Are you going to put clean linens on the bed, put on a fresh gown, put on a mask, put on fresh gloves, clean the mattress, use hand sanitizer, or remove the dirty linens, or wash your hands with soap and water? So we just took off our PPE, right? We took off our gown, then we took off our gloves, and now what's going to be our next step? And I thank you all for participating. You guys are doing great. And let's see these answers coming in. All right. Highest majority vote is wash your hands with soap and water. And the next is to put on fresh gloves. So let's go with the highest majority vote of washing your hands with soap and water. See if that's correct. Absolutely. Okay, so this is where you are going to wash your hands with soap and water. Even when you're wearing gloves, some germs can still get on your hands. You should always clean your hands after taking off gloves. And remember, wearing gloves is never a substitution for hand hygiene. Anytime gloves are removed, hand hygiene should always be performed. And when you don't know the infectious cause of diarrhea, you want to always wash with soap and water, as we said at the beginning of this scenario. So, excellent. And now we're coming to the end. So now that you have cleaned your hands, you are ready to continue putting the clean linens on the bed. So you guys all did great with this quick little infection control challenge. And before we go on, I want to do a quick recap of the proper infection prevention control steps in the proper sequence that we just did for that scenario. All right, so we pulled the sheets down. We probably got some diarrhea on our hand. Whether we see it or we don't, we're going to go through the steps again, how we took care of the situation. We washed our hands with soap and water. We then put on a fresh gown, put on fresh gloves, took that dirty linen off the bed and put it into the proper soiled linen bin. We then cleaned the mattress, still with our PPE on. And then now we're taking our PPE off. We removed the gown, we removed our gloves, we washed our hands with soap and water, and then we were able to put the clean linens on the bed. So excellent. Great job. Hopefully this was helpful to you. And again, when that unexpected does happen in your healthcare role, you now have the infection prevention control tools to help keep yourself and your patient safe. And the key takeaways from this brief challenge today: infection control actions can prevent the spread of germs. Cleaning your hands helps decrease the risk of infection. And proper use of PPE helps to decrease the contamination. Carefully read your EPA-approved disinfectant labels before use. So good job again. And before we wrap up, as we always do, we're going to remind you about your certificate of training. There are a few requirements in order for you to receive this, and which are also you can use, get 0.5 hours of continuing ed for the dental and the EMS professions. So in order to receive your certificate of training, you must have completed the pre-session survey, participated in today's session, and complete the post-session survey. And the link for the post-session survey will be sent to you via email tomorrow. It's going to be available for 1 week, and the survey does close at midnight on April 24th. And once you complete the requirements, the certificate will be emailed to you on April 27th. And post-training resources for this PowerPoint, or you can find these on our site. We'll send some of the resources out to you. And also, you can follow Project Firstline in social media. We are on Twitter, Facebook, Instagram, and LinkedIn. And we have some upcoming couple more interactive sessions that we are going to be sharing with you guys. The first one's going to be May 1st, and it's Fidgeting Felix Gets an IV, and that will be presented by Allison Thurber, and it's from 12 to 12:30, another infection control challenge. And then on May 15th, What's Wrong with This Picture, another 12 to 12:30 infection control challenge presented by all three of us, Stephanie Doyle, Allison Thurber, and myself. And we go over different scenarios. So hopefully you could join us and bring your colleagues and come have fun doing that. Our references for today are right here. And I invite you now to take the 3-question poll on your screen. And as you do that, I'm inviting my colleague Stephanie Doyle to come on camera for the Q&A session. And on behalf of Project Firstline Rhode Island, we thank you for joining us today. You all work so hard in the community. Please stay safe and, come join us again for our future ones coming up. Then everybody enjoy the rest of your afternoon. And thanks again for joining us. And hopefully we'll see you in a couple of weeks. Come join us back for Fidgeting Felix Gets an IV.